This is examination of the eye.
Hi, Abby.
Dr. Hayden.
My name is Deidre. I'll be taking care of you today. Is that okay?
Yeah.
Thank you.
So the first thing you're going to do after you explain to the patient, which is you're going to inspect the external ocular structures. You're going to check the lids, the conjunctiva, the iris, the cornea, and the pupils. And it's best to gently move eyelids up and down to obtain a better view. Next, you're going to inspect visual acuity or check visual acuity by using a Snellen chart or any other printed material available. You're going to measure from about 12 to 14 inches away, have the patient check both eyes together,
Can you read this?
Yes.
and then have the patient place one hand over each eye individually and check visual acuity individually by eye.
Cover your left eye, please. Can you read this?
Yes.
Okay. Cover your right eye. Can you read this?
Yes.
Thank you.
Next, you're going to evaluate extraocular movement. And by using two fingers, you're going to check in all 6 directions by making a big H with your fingers.
So if you will just follow my fingers with your eyes and not move your head, please.
And then you're going to check convergence by checking both ocular movements and pupillary constriction by moving your fingers toward the bridge of the patient's nose. Next, you're going to test the patient's visual fields. You're going to ask the patient to cover one eye, and you will cover your own opposite eye.
So I'm gonna have your situation just a little bit closer so we can see. So could you cover your left eye, please? Okay. So I'm gonna bring my fingers in, and I want you to tell me when you can see my fingers.
No. No.
You're going to test all 4 cardinal directions for each eye: up left, up right, down left, down right, for each eye individually.
No.
You're going to ask the patient to indicate when they see your fingers move.
No.
Okay.
Your examiner's hands are going to be halfway between the patient and the examiner during the visual fields test.
Could you cover your right eye, please? Can you tell me when you see my fingers, please?
No. 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 No.
Next, you're going to check pupillary response to light, both directly in both eyes, and then indirectly, an indirect response with both eyes using the swinging flashlight method.
Indirect.
Light in one eye, watch in constriction in both. For indirect response, move the light away, wait for dilation of both, Move the light to the other eye. Watch for constriction in both. Lastly, you're going to perform a fundoscopic or retinal examination. You're going to examine both sides using the ophthalmoscope. You're going to hold and position the instrument correctly
The left hand,
to the left eye.
and then you're going to calibrate the ophthalmoscope by finding an object on the wall about 5 feet away from you, and then adjusting the parameters until it's no longer blurry. Okay. Left hand to left eye. I'm going to put my hand on her shoulder. And as I approach the patient, I'm going to find the red eye reflex and then progress further in for the examination. I'm coming in at about a 30-degree angle. I'll tell you when I've got her red eye reflex. About right now. So now I'm going all the way in. And now I'm going to have her look into the scope. Okay, I can visualize the optic disc, the retina, and the blood vessels.
Make sure that you tell the SP that you're observing the retina, blood vessels, and the optic disc during your clinical examination.
Now I'll examine her right eye. So I move the scope into my right hand. I'm going to find the red eye reflex coming in at about a 30-degree angle. I've got it right here, coming in. Look into the light, please. I can visualize the retina, the optic disc, and the blood vessels.
This completes the examination of the eye.